Hi, this is Chee-Wee here. Now in this video, we will be looking at standing posture, the factors that affect it, and also how to perform an observation of a person's posture. Now these are the aims of the video. At the end of this video, we should be able to recognize components of standing posture, be aware of the effects different standing postures have, as well as be able to assess normal standing posture, recognize deviations from normal standing posture, and describe the effects of poor posture on muscle work and its potential for injury. So what do we mean by posture, and how would you describe good posture? Posture is the body position that we adopt and also the arrangement of body segments in relation to each other when we place our body position in certain configurations. Good posture occurs when it is effortless, does not lead to fatigue, is not painful, and can be held for a relatively long period of time. Usually, when we see someone in a sitting or standing posture, they appear to be staying still, and there is little movement. However, in reality, there are little movements happening within the posture itself. These movements are due to the automatic switching of on and off of muscles that help to correct any deviations of our body position to retain the position we're in. These little muscle contractions are as a result of neurofeedback mechanisms. If we were to measure it using a specialized equipment, we'll notice that there are tiny corrections of our body position. And this process of tiny corrections is called postural sway. When we talk about postures, there are usually two types of postures that we talk about. One is static posture, and the other is dynamic posture. Static posture is when we adopt a certain body position and then try to stay in that position. For example, if we were to stand still, this is a static posture, and our lower limb and trunk muscles will be making small adjustments to maintain this position and ensure that our balance is controlled. Dynamic posture is our ability to maintain stable during certain movements that we make voluntarily. For example, when we reach for a book from a shelf while seated in our chair, there will be trunk muscles stabilizing our body and upper limb muscles, working to stretch out to reach for the book. Now during this movement, we remain stable and without falling off our chair. Now that we know what static and dynamic posture are, let's talk a little bit about the standing posture. So what are the advantages of adopting a standing posture? The most obvious advantage is that standing frees our hands to be able to manipulate objects and perform tasks with our upper limbs. However, there are also disadvantages for our standing posture as well. In particular, this posture puts an increased amount of work for our hearts. It also increases the stress on our vertebral column, pelvis, and lower limbs. In terms of standing posture, there is an ideal alignment. However, most of us will deviate slightly from this ideal alignment. The aim isn't to impose this ideal alignment on everybody, although we can try to be as close to this alignment as possible. The ideal standing alignment is based on a plumb line, also called the line of gravity. The line of gravity should intersect the following points: the mastoid process, which is the large bony lump behind your ears, slightly anterior to your shoulder joint, go through or just posterior to your hip joint, slightly anterior to your knee joint, and a few centimeters anterior to your ankle joint. In this position, you should have normal curves within your spinal column with a thoracic kyphosis and cervical and lumbar lordosis. Also, in this ideal alignment, your pelvis should not be tilted anteriorly or posteriorly. This means that the anterior superior iliac spine, or the ASIS, is just vertically above the pubic symphysis. Also, the superior surface of the sacrum should be about 30 degrees to the horizontal. As I mentioned before, most people don't have the ideal posture. However, we can still achieve an optimal posture. This means that our body segments are vertically aligned. The compression forces are evenly distributed over all our weight-bearing surfaces in this particular alignment. There is no excessive tension on our muscles and ligaments, and also our center of mass is positioned within our base of support. What if we have poor posture? What will this mean biomechanically, and how will this present itself in our body? If there is postural malalignment when we are in our static postures, there will be changes in the interrelationship between the body segments. This can be seen in the intersection of the line of gravity with the joints that we have mentioned earlier. The shoulder, hip, knee, and ankle. If the body segments move away from the line of gravity, this means that there is a change in the amount of muscles working to maintain our posture, and this will change the forces that is distributed across our joints. Over a longer period of time, damage may accumulate and cause tension and pain in our muscles and joints. You may have seen these 4 types of postural alignment before. Now, these are some of the more common postural alignment types that people adopt. We have already talked about the ideal alignment. We will now go on to talk a little bit about the kyphosis lordosis posture, the flat back posture, and the sway back posture. One thing to take note on your own is to look at the relationship between the line of gravity with the shoulder, hip, knee, and ankle joint. Notice if there are any changes in these alternative postures as compared to the ideal posture. In the kyphosis lordosis, there are 2 main features. Firstly, the thoracic spine is more kyphotic, and that is to curve backwards. As a consequence, this may cause the lumbar spine to be more lordotic, that is to curve forwards. Because the lumbar spine is connected to the sacrum and the pelvis, this increased lumbar curvature will cause the pelvis to anteriorly rotate. All of this means that there is additional lumbar curvature, there will be additional stresses and tensile forces acting on the lumbar intervertebral discs. Our next posture we'll be looking at is the flat back posture. As the name suggests, the back has a flattened profile in this particular posture. This is due to the loss of lumbar lordosis, which causes the pelvis to tilt posteriorly. It is also worth mentioning that the head and the hip is in front of the line of gravity compared to the ideal posture. The next posture is the sway back. Now, this particular posture can often be seen in people with occupations that require them to be on their feet for most of the day. For example, physiotherapists. In this posture, the most obvious feature is that the hip is being far in front of the line of gravity. Accompanying this are the presence of an anteriorly tilted pelvis and a thoracic kyphosis. Those are the more common postures that you may encounter in everyday life. Another postural malalignment that may cause significant health issues is scoliosis. Scoliosis is when the spine is tilted in the frontal plane in relation to the pelvis. Severe forms of this postural malalignment will mean compression of vital organs such as the lungs. There will also be skin creases along the trunk from the compression of certain regions. This will cause a leg length difference, which may also confer the person with an abnormal gait pattern. Now that we have looked at the various types of posture, how do we go about assessing it? There are some principles that you can follow when assessing someone's posture, and the following slides will outline some of these principles. It is important that we assess standing posture because it helps us to find out the probable cause of any problems they may have and whether this is related to their posture. As the body segments are all interlinked, this means that any alteration in position of one body segment will cause a change and potentially cause issues in another body region. As you can see from the malalignment postures previously, any changes in the lumbar spine curvature will have an influence on the pelvis rotation and possibly knee and hip positions as well. These altered joint positions will cause some muscles to work harder in order to maintain stability and to still be able to perform everyday tasks. Now, before we start any of our assessments, you must always be able to remain professional and to maintain it at all times. So we should always consider how your patient is feeling, and that this will help them gain their confidence in you. When assessing posture or for any sort of clinical examination, always ensure that the room is well lit and that it is comfortable. The patient should be suitably undressed so that you are able to observe the body regions concerned. However, always be sensitive to the personal and cultural preferences of the patient as well, and adapt your approach as accordingly. To assess the person, get them to stand with their feet slightly apart. Then observe their build, and then move around the person to gain various points of view in order to see any differences or any strange orientation and alignments in their bodily positions. So you should download the assessment guide for standing posture and use it to help guide your observations. Do remember to compare the symmetry of the left and right sides of the body, and also to compare the positions of the shoulder, the scapula, the cervical, thoracic and lumbar spine, and the pelvic region using the iliac crest for comparison. Also, you should also be looking at the body, is it leaning in a certain direction? And these should give you a hint as to whether there are any abnormalities or any asymmetry within the body alignment itself. So do remember to be systematic and also to remember to record your findings. Now, if you can find someone at home to practice this, try this out on them first. You'll find that it may be difficult initially to see much, but through multiple tries, you'll start to improve your observational skills. So I hope you find this video useful, and I'll see you in my next video. Bye.